welcome to Era. I'm Dr. Muhammad Talat, Assistant Professor of Radiology, Cairo University. Let's go directly to our cases, our interesting cases today. This one is a non-contrast scan for an adult patient. As you see here, we have bilateral subdural collections at the frontotemporal parietal regions, more larger on the left side, measures about 3.1 centimeter in maximum thickness, while on the left side, it measures about 2 centimeter in maximum thickness. Both subdural collections induce or cause mass effect in the form of effacement of the cortical subside, look for this effacement of the cortical subside, and compression of the ventricular system, more on the left side, with midline shift from the foramen of Monroe towards the midline line. It measures about 7 millimeter, so it exceeds 5 millimeter. And according to the guidelines, once the midline shift exceeds 5 millimeter, so it is indicated for surgical interference. These subdural collections show different densities, as you see here. On the right side, this density is very close to the density of the brain tissue, so it is subacute subdural hematoma. While on the left side, you will see different densities between hypodense areas, like this one, and hyperdense areas like this one. This one indicates fresh blood, so we have here acute on top of chronic. This is the acute one. And if we go up, this is the chronic blood density. So we have different blood densities. On the right side, subacute subdural hematoma. On the left side, acute on top of chronic subdural hematomas. As we reviewed in the last video, that there are many differentiating points between the subdural hematoma and the extradural hematoma. And one of these differentiating points, the inner border, look for this one, the inner border for the subdural hematoma. It crosses the sutures. This is the site of the coronal sutures, and it is characterized by the inner concave border. So for sure, this is subdural collection. The left side, it shows almost concave, inner concave border, but sometimes you can see within this border slight convexity. And from the literature, any chronic subdural hematoma can change its inner border from concave to convex border. So take care of this point. Let's go to some complications that we need to focus today. Look for the midline shift. Look for the brain tissue here. We have here crossing of the brain tissue from the left side to right side. So we are suspecting subfalcine brain herniation. If we go to the coronal plane, for sure, we have crossing of the brain tissue from the left side to right side. So we have subfalcine brain herniation. Very common to see subfalcine brain herniation. I want also to focus on the hippocampal area. Look for this one. This is a tentorial leaflets, tentorium cerebelli, and we don't have any brain tissue crossing this area. Also, we have, let's go to the axial plane. Look for the basal cisterns. It's very clear. This is the circummesencephalic cistern. It's very clear. So we don't have any uncal migration or medial displacement of the uncles. Even the temporal horns here. This is a normal location for the temporal horns, so we don't have any uncal brain herniation. So in conclusion, we have bilateral subdural hematomas of different ages and exerting mass effect as described. We have subfalcine brain herniation. We don't have any uncal brain herniation. This is our second case today. Non-contrast scan for an adult patient. As you can see with me, we have bilateral subdural collections crossing the sutures, more larger on the left side. We have also midline shift, as you see at this lesion. Suspecting subfalcine herniation, we will identify this abnormality in the coronal plane. We have also, if we concentrate at this area, we will see this is the site of the ambient cistern. It is totally obliterated. It is not clear. So let us concentrate at this region. So we have here at this region, this is the site of the tentorium cerebelli, and we have here a part of the brain tissue crossing the tentorium cerebelli, not like this part. This is the tentorium cerebelli. Nothing is crossing across the tentorium cerebelli. So we have something abnormal on the left side. If we go more superiorly, we will find this is a temporal horn on the left side. It's crossing towards the midline medially. Look for this one. This is the right side. The left side is shifted medially. Also, we have here part of the brain tissue. This is the uncus. It is herniated into the ambient cistern. This is the site of the ambient cistern. Let us change the color. This is the site of the ambient cistern. It was interrupted by the uncal herniation and the medially deviated temporal horn. So we have for sure some of the brain tissue. Look for this one. This is brain tissue herniated into the ambient cistern, and this is the midbrain. So it is compressed by the herniated brain tissue across the tentorium cerebelli. So for sure we have uncal herniation. One of the red flags in any masses or subdural collections or any extravasal collections is emergent CT brain. We should focus if there is any brain herniation or not. So for sure we have uncal herniation on the left side. One of the complications of the uncal herniation, brainstem hemorrhage. We don't have any brainstem hemorrhage. And also, this is the course. This is the basilar artery, and this is the course of the posterior cerebral artery. In case of uncal herniation, it can lead to significant compression on the posterior cerebral artery and can lead to acute infarction along the medial temporal loop. We don't have any infarction along the territory of the posterior cerebral artery, and we don't have brainstem hemorrhage. Let's go to the coronal plane. Here we have shunted tube. It is malpositioned. Its lower tip is present in the sella tertia, so we should report this one. We have also some of the brain tissue crossing the midline from left side to right side, so we have subfalcine brain herniation. And also we have here some of the brain tissue here. It's crossing the tentorium cerebelli. This is the site of the tentorium cerebelli. And also we have the temporal horn here. Let us make this one. This is the temporal horn also crossing the tentorium cerebelli. So we have part of the brain tissue and temporal horn crossing the tentorium cerebelli on the left side. We have also some of the brain tissue. Look for this area crossing the tentorium cerebelli. This is the tentorium cerebelli. So for sure we have left-sided uncal brain herniation. So in conclusion, we have a case of bilateral subdural hematomas, and these subdural hematomas show different densities. So we have acute on top of chronic. We have two types of brain herniation, subfalcine brain herniation and also left-side uncal herniation. Also, if we concentrate more, we will find some atrophic changes in the frontal lobes. Look for the cortical cell site in this area. And also we have significant atrophic changes also and loss of volume in the temporal horns here. These findings are suggestive of frontotemporal lobar degeneration, one of the neurodegenerative disorders causing dementia. We will not focus on this area because we are dealing now on the emergency CT brain. This is the second case for today. Thank you so much, and thank you for listening to our lecture.